Hi everybody, and welcome to another episode with the Anxious Resistance. Today I'm going to be talking about something that I do fairly often at my work, working in the hospital in inpatient psychiatry, and that is ketamine administrations. So many of you probably know or have even experienced ketamine treatments for yourself, but they have really gained a lot of popularity in the last 5 years, and we are doing them in the hospital where I work. And a lot of patients are actually getting these treatments because we see a lot of benefit from these, and these happen to act a lot quicker than other medications do. Ketamine works faster, and so we really like that, especially in an inpatient environment where people are often suicidal, at risk for self-harm or other things like that. And so it's really gained a lot of popularity. And as far as I know, not just the psychiatrists use ketamine, it's also used a little bit more often down in the emergency department with patients who are in crisis. And I actually really like ketamine. I have never used it myself, I've never experienced it, but it is something that I administer very often. I wouldn't say every day at work I give a ketamine treatment, but maybe every other day. And even if I'm not, there are other nurses who are administering these treatments, and so they are happening often. There are two ways that we typically do it. The first way is intramuscular injection. So basically that's just your normal injection. We often give it in the deltoid muscle on either side here, or we can give it in the gluteus maximus in your behind. And this is my preferred way to do it because it's a little bit simpler, it's easier on the patient as well as the staff, because it's just the one shot and done. Now on the other hand, what we also do are ketamine infusions. So that's when we hook you up to a peripheral IV, we get that going, we start a ketamine drip. Now this one has its advantages as well, particularly because you can stop this treatment. So say you're having a bad reaction to the ketamine, you can stop the IV infusion, where if you have the intramuscular injection, well, you kind of just have to ride it out, even if it's kind of a bad trip, which has happened before. Now I've really only had one experience out of all of my ketamine treatments that I've administered that was a little bit rough, mostly because this patient had some tachycardia, and sometimes that's a problem when you administer ketamine. It can increase heart rate, which is something you have to be very aware of, and also why we always monitor patients. We get a baseline set of vitals, we do have vital signs at 15 minutes, 30 minutes, 45, an hour, and sometimes depending on, how they're reacting to the treatment, we may monitor even longer than that. And this is because there are changes in vital signs. I actually was surprised to find out, but ketamine will actually raise blood pressure and will raise heart rate. Now, I thought where this is being a fairly sedative medication, I mean, ketamine was originally used for sedation in the operating room and places like that. And so I thought, well, this is going to drop blood pressure. Why are we so worried about it going high? Anyway, it does happen. It's a little bit counterintuitive, but that is what happens with it sometimes. And again, I've only had this happen one time, and I have administered many ketamine treatments at this point. So I think it's a really good thing for patients. Most of them, almost all of them, have a positive experience doing this. Again, the actual treatment only lasts for about an hour, hour and a half, till you start to feel the effects of the medication wear off. Now, ketamine, I've done a video about before, which I'll link up here for you, is an NMDA receptor antagonist. So that means it blocks the NMDA receptor, which is a glutamate receptor, and we still don't fully understand or grasp how this works to treat depression, but we do think that perhaps overactivation of the NMDA receptor the NMDA receptor. Overactivation of the NMDA, the other glutamate receptor is AMPA. So sometimes I get them jumbled up in my letters. So the NMDA receptor, when this one is blocked, it kind of lowers that excitation, allows for some sort of normal modulation of the neurotransmitters that are involved here. Now, again, we don't fully understand this, but we do know that ketamine has rapid effects. People can feel a difference, and many of these people do after, the hour and a half of just the ketamine. And what the patient does during the treatment is they just lay in bed. We usually just turn the lights out. There's usually a psych tech in there who monitors them, who's checking their vital signs, is in contact with the nurse in case anything goes wrong. The nurse will pop in on occasion and just make sure everything is going okay. And so really it's pretty simple. Some people kind of fall asleep, and that's totally fine. Other people trip a little bit and say some weird things, do some weird things. Other people get kind of emotional. It can kind of bring up some past traumas and things like that, and so some people have to process that a little bit. Again, it's another reason why we have the psych tech with them. Although I think the best way that these ketamine treatments can be done is with a psychotherapist there with you. And I think there are a lot of places that do it that way, where you do a therapy session, whether that's cognitive behavior therapy, dialectic behavior therapy. But what it does is it allows you to process whatever these feelings are that come up. And I actually think that's really important to the effectiveness of the treatment. Now, you are probably going to get some benefit, whether you're having therapy or not. Most people have benefit. And just a side note real quick, some people it takes 2 to 3 treatments, 3 to 5 treatments even, until they notice a real overall positive effect in their mood. Some people get a little bit bummed if the very first treatment doesn't take effect and they don't feel a lot better immediately, but almost everybody feels at least some little bit of improvement. And again, these are inpatient people that I'm working with, and so they're often in crisis. They want to see that benefit immediately, and I don't blame them. It's a difficult place to be, and it can be frustrating, and so you want to get better and get home as fast as you can, and I understand that. But these do take, sometimes it takes several treatments, and we will give several treatments in the hospital while they're there. Again, back to the therapy part of it, I think the best way to take advantage of ketamine is to have that psychotherapy while you are experiencing the ketamine treatment. That's because ketamine, not only does it block this NMDA receptor and produce antidepressant-like effects, but it also makes the brain more plastic, which means it can create connections faster. And in other words, you can change your thoughts. Your brain's in a pliable state when you're on ketamine. So if you have some therapy that goes with it, it can go a long ways towards helping you change your thought patterns and help you feel not just chemically better, but have healthier thought patterns afterward, especially if you're able to process some trauma or something like that while you're on it. Now, there are some medications that may be better with the psychotherapy included, such as with the psilocybin, MDMA. Again, those are still in research as well. So overall though, ketamine I think is honestly such a blessing, and it's a miracle. It really helps these people who are in crisis, and I see a lot of positive change. There are the 2 routes of administration that we typically do for it, which is intravenous in the IV, peripheral. We usually do it in the AC in the arm, or sometimes in the forearm, depending, but you don't have to get a very big IV in to do this, and so that's not a huge deal to do it IV. And then the IM is just a simple injection, and you monitor it. The doctors, psychiatrists typically dose the ketamine based on weight, but they also may dose it based on experience. So if the first treatment they really didn't feel much of an effect from it, they're probably going to dose it higher for the next treatment. Again, vice versa is also true. If it's they get pretty trippy or it just puts them out, they're probably going to lower that dose. And outside of like a professional hospital, I work in a teaching hospital, it's a level 2 trauma center. I think sometimes ketamine is not administered as appropriately as it should be. You get these health clinics that just pop up here and there, and they're like, oh, come for your spa day, but also we'll throw a little ketamine in there too if you pay an extra $300. I would be wary of places like that, especially if you truly are looking for this treatment to help with major depressive disorder, generalized anxiety disorder, even help some comorbid PTSD or something like that. Please seek a professional that is reliable, knows how to do these things, and will do it well and appropriately, and not just throw ketamine at you. If you guys have ever experienced ketamine treatment, let me know about it in the comments. I want to know what your experience is. Maybe you've been to some of these clinics and maybe you've had a better experience than the one I'm illustrating here. Maybe you've been inpatient yourself and you've had these treatments and they've really helped you. Maybe you are a person who these haven't helped. Let me know about it because I want to know more about ketamine. Again, one of the things that I really like and I push for a lot on this channel is using magnesium supplements. Now, magnesium actually blocks the NMDA receptor similar to ketamine, only it does this much more naturally. The body is just attuned to using magnesium to do this. And ketamine is very viable and I love it. But if you can do it naturally, do it just by supplementing magnesium, why wouldn't you do that? That's so much easier, so much more beneficial, I think, overall to the body. So check out my video I did up here. I'll link it up here for you about magnesium treatment. I've been doing it for a long time. I love it. It has a very similar mechanism of action to ketamine, except for you don't have all these side effects. You don't have to monitor your blood pressure. You don't have to worry about a crazy trip. Anyway, thank you guys so much for watching this video. If you found it beneficial, please like it, share it with somebody who may benefit from it. Follow our channel for more content just like this. It is my mission at The Anxious Resistance to make mental health information consumer friendly, easy for people to understand and help educate themselves so that they can truly take power over their own health care, find the solutions and things that work for them so that they can live their best lives. And that's what I've experienced in my own life, and that's why I want to share it with you. And thank you guys so much for watching.